today I am going to discuss about hypertension. We know that hypertension is a deadly disease, but the unfortunate part is that most of the time we are not able to diagnose the hypertension early. So hypertension is silent killer. Basically, in the early times, there is no symptoms of recognizing the hypertension. Most of the time when we do the blood pressure monitoring and we check the blood pressure, suddenly we understand that this patient blood pressure is high. And most of the time when we cross-check the blood pressure 2 or 3 times, and when we take the mean of the blood pressure, we diagnose it that this patient is having blood pressure, but there is no symptoms is there. So sometimes it is very difficult to diagnose blood pressure. And this is the reason why we diagnose late blood pressure, and the patient lands with several complications also. And there is a cardiovascular continuum also, which have some risk factors like obesity, blood pressure, dyslipidemia, insulin resistance, and genetic factors are also there, and some irreversible risk factors are there, like smoking also there. All leads to enhance the risk of getting cardiovascular disease early in any of the person. So today we are here to discuss more about the hypertension. So what are the symptoms of hypertension? So hypertension, if the blood pressure is more than 150 by 100 or 160 by 100, sometimes patient may feel symptoms of headache, malaise, and vertigo also. And sometimes patient does not have any symptoms also. So in my view, everyone should check blood pressure at least annually, 2 or 3 times by the consultant doctor, and if possible also do the home monitoring of blood pressure even in patients who are not suffering from hypertension also. If the patient is suffering from hypertension, home monitoring of blood pressure is recommended worldwide. Now we have several types of home monitoring blood pressure instruments also that we can use to check the blood pressure, and write it down in the paper so that we can understand that how is the blood pressure. Thank you so much.